Good day everyone, my name is Echo, physical therapist. For this episode, let's talk about stiff neck. What causes it, remedies to be done at home, when to see a doctor, and my preferred exercises to solve your stiff neck problem through towel therapy. This is based from Mulligans Concept, towel-assisted cervical snag.
Disclaimer: these are suggested therapeutic exercises only by Echo. It is to provide general self-treatment instructions for conditions that have already been diagnosed by a qualified medical provider. If pain increases or condition worsen, please stop the exercises. The content is not intended to be a substitute for professional medical advice. The information in this video is by no means complete and does not apply to all conditions, especially if you have other health-related issues. May God be with you all.
So what causes your stiff neck? Number 1 is sleeping with the neck at an awkward position. Falling or sudden impact that pushes the head to the side, such as sports injuries. Turning the head side to side repeatedly during an activity like swimming using front crawl stroke. Slouching with poor posture while viewing the computer monitor or looking downward at a mobile phone for prolonged periods, sometimes referred to as text neck. Experiencing excessive stress or anxiety, which can lead to tension in the neck. Holding the neck in an abnormal position for a long period, such as cradling a phone between the neck and shoulder. If you have a painful stiff neck, you can try these several remedies to reduce the pain and lessen the stiffness. These can also be used for prevention. Number 1 is apply heat or ice. Hot and cold therapy is one of the most effective ways to deal with stiff neck. You can use these methods alternately depending on your condition. Hot packs are great for loosening the bunch of muscles on your neck and shoulders. Heat promotes relaxation and encourages increased blood flow to the affected area. When this happens, more oxygen and nutrients are delivered to your tired muscles, speeding up healing in the process. As long as the area is not inflamed or swollen, you can gently place a hot pack on your neck and shoulders. You can even take a hot shower or soak in a nice warm bath for a full body experience. Cold therapy, on the other hand, works best within 24 to 48 hours of a pain flare-up. If your neck and shoulders feel tender or are swelling, cold packs can help reduce inflammation by constricting blood vessels and limiting congestion. Neck ice packs also numb irritated nerve endings, which significantly cut down discomfort. Place an ice pack to the neck for 10 to 15 minutes at a time. Make sure to use the gel pack with a cloth cover or barrier with your at it to prevent ice burns and skin damage. So when to see a doctor? If your neck pain interferes with your regular daily activities, you should see your doctor. Other reasons you should seek medical care are pain started after an injury or car collision, pain that spreads down your arms or legs, weakness in your arms, hands, or legs, headaches alongside pain. These additional symptoms could be a sign of a more serious injury to your neck, like a herniated disc, pinched nerve, a bulging disc, or an arthritis. The Mulligan Concept is a form of manual therapy developed by Brian Mulligan, a physical therapist. It is designed to reduce pain and improve patients' range of motion. This involves the NAG, SNAG, and MWM for treatment of musculoskeletal injuries. NAGs stand for Natural Apophyseal Glides. It is used for the cervical and upper thoracic spine level. It consists of oscillatory mobilizations applied to the facet joints of C2 to T3. SNAGs are mid-range to end-range facet joint mobilizations applied anterosuperiorly along the treatment planes of the selected joint. It is useful for grossly restricted spinal movement, and it is the treatment of choice in highly irritable conditions like cervicogenic headache. SNAGs stand for Sustained Natural Apophyseal Glides. It involves combination of a sustained facet glide with active motion followed by overpressure. SNAGs can be applied to all spinal joints, the rib cage, and to the sacroiliac joint. The therapist applies the appropriate accessory facet glide while the patient performs the symptomatic movement. This must result in full range, pain-free movement. SNAGs are most successful when symptoms are provoked by a movement and are not multi-level. They are not the choice in conditions that are highly irritable. Although SNAGs are usually performed in weight-bearing positions, they can be adapted for use in non-weight-bearing positions. And this will be our technique of choice in addressing stiff neck through towel-assisted therapy. Lastly is the mobilization with movement or MWM, applicable to spine, specifically in the lumbar section and also for the limbs. Mobilizations performed are always into resistance but without pain, where immediate relief of pain and improvement in patient's range of motions are expected. So these are the specific treatments for a stiff neck. Number 1, the cervical snag mobilization technique. Let's assume that the patient has left-sided stiff neck. Use the edge of a towel or pillowcase to get a good purchase on the specific stiff segment at the left side of your neck. Using the left hand, reach across to your right side and pull the towel straight down to anchor it. With your right hand, reach over the top of your left arm and pull the towel across your chin to your right as you turn your head in the same direction. Hold this position for 3 to 5 seconds, rest, and then repeat 10 times. These will mobilize and stretch your sternocleidomastoid muscle depending on what side you do the motion plus attraction feeling. It is recommended that you will do both sides to have a good and equal muscle flexibility. The trapezius stretch, assuming again of having a left-sided neck stiff neck. Flip your towel towards your back to the side where your neck hurts. Reach backward and grab the end of the towel, and then cross the hand in front, diagonal towards the other side, and then side bend your neck away while putting pressure on your towel. Hold it for at least 10 to 15 seconds, go back, then repeat it 5 times. You can move the towel up or down as needed depending on your preference. This will stretch the upper trapezius muscle to where your towel is placed. The Scalene stretch. Sit straight up in a chair to stretch the left scalene muscles. Reach your left hand down and anchor it at the bottom or leg of the chair to keep the shoulder depressed. Gently side bend your neck to the opposite side until a stretch is felt. You may use your free hand to gently guide your head a little further to stretch. Rotate your head to the right and then extend the neck backwards. Hold this stretch for at least 30 seconds, done 5 times each side. The cervical flexion extension. So put your towel across the back of your neck and then pull it forward, putting some manageable pressure on your neck, and then slowly lean your head back in extension up to your comfortable level. Hold that for about 5 to 10 seconds, then move your head forward to chin tuck position. Continue to do that until you feel that the range of motion improves, and it should be done in a controlled manner. The thoracic extension mobilization on a foam roller or a pillow. Limitations in thoracic joint mobility can contribute to a musculoskeletal disorders in the neck. Multiple studies have shown that the thoracic spine manipulation or mobilization can improve neck pain and its function. To perform thoracic extension mobilization, lie face up with a foam roller or 3 pillows horizontally across your mid-back. Keep your butt down, knees bent, and feet flat on the floor. Put your hands behind your head for support. Breathe out and depress your ribs toward your navel. Maintain this rib position by bracing your abdominals. Slowly extend your mid-back over the roller or pillows. Hold it for 5 seconds. Relax, then repeat. Inch by inch, make your way from your mid to your upper back area. Do not perform this on the lower back. The cervical towel roll technique. The use of a simple rolled-up towel is a gentle relaxation exercise that encourages the natural lordotic curve of the neck. The rolled towel provides a curved surface for the relaxed neck to stretch on. It could be considered a myofascial release of sorts, to release the soft tissue of the neck and allow neck to move in its normal range of motion. Lie down for at least 10 minutes. Once you feel comfortable with it, you can progress incrementally up to 20 minutes. If you think your pillow may not be supportive and causing your stiff neck or pain, you can incorporate the towel roll with your pillow and sleep on it. And that is how you manage your stiff neck with the towel. So how's my episode po? Kindly like and subscribe to my YouTube channel, comment below, or send me a message for your suggestions or critics. Thank you very much.